The keto diet, also known as the ketogenic diet, is on the rise. Did you know that this eating routine is traditional among the Inuit, the Maasai, and certain North American indigenous peoples? But what is the keto diet? It's simple. It's a strong reduction of carbohydrates that is filled with lipids, commonly called good fat. But is this diet good for the body? Or, on the contrary, should we be wary of it and opt for another type of diet for weight loss? Elements of answers in this video. And let's start right away by discovering the benefits of this diet. Number 1. Weight loss. One of the major obstacles to going on a diet is often the fear of being hungry and having to deprive yourself of pleasurable foods. With the keto diet, goodbye to the unpleasant feeling of hunger that nags you. No more calorie counting. The idea is to remove certain foods from your diet and replace them with others, but not to drastically reduce your portions. With the famous good fat provided by the food you eat, you won't feel hungry, you won't suffer, and your weight loss will be easier and more lasting. Number 2. Type 2 diabetes. The ketogenic diet helps keep certain diseases under control or even limit their onset. This is the case with type 2 diabetes. Various studies have shown that the keto diet can lower insulin levels. Patients who participated in one of these studies even saw their blood sugar levels drop by 16%. And a third of these patients were able, after medical advice, to stop all medication and treatment for type 2 diabetes. The keto diet therefore offers hope for people with type 2 diabetes. Number 3. Epilepsy. The brilliant Johns Hopkins University has delivered the results of an amazing study. The keto diet would help fight epilepsy. 50% of patients on the keto diet saw a reduction of at least half of their seizures. While medication remains the first line of treatment, the ketogenic diet works miracles when these pharmaceutical treatments have not worked for a patient. In children, the keto diet works even better. Number 4. Against cancer. In the past, the keto diet was considered as a solution in the treatment of cancer. Cancer cells, unable to assimilate ketone bodies, disappeared. In 2018, careful studies have been conducted. Indeed, the ketogenic diet triggers an anti-tumor effect on certain cancers, such as glioblastoma multiforme. Unfortunately, no effect could be observed on other cancers, so research has turned to other therapies to eradicate cancers. Number 5. Alzheimer's disease. Alzheimer's disease remains incurable and causes dementia in humans. Although the keto diet cannot cure the disease, it can reduce the symptoms and slow down the progression of the disease. How? The so-called ketogenic foods slow down the aging of brain cells and significantly increase the cognitive abilities of elderly people. In the absence of a cure, the ketogenic diet brings hope and comfort to patients and their families. However, beware. The keto diet requires a drastic change in diet, and the elderly may have difficulty adapting. Therefore, seek the advice of a doctor before taking the plunge. Number 6. Parkinson's disease. It is possible to prevent the appearance of certain degenerative diseases thanks to the keto diet, and this would be the case for Parkinson's disease. Studies are underway to determine the actual effectiveness of this diet in Parkinson's disease, but it is already known that it helps to improve the quality of life of patients via a reduction in symptoms. As with Alzheimer's disease, seek the advice of a physician before starting the keto diet yourself or advising an elderly loved one to do so. The easiest way to prevent Parkinson's disease would be to adopt the ketogenic diet now. Number 7. Alcohol withdrawal. Addictions are difficult to manage, and sometimes withdrawal from a substance can be difficult to live with, even dangerous. But there is good news. The keto diet may help make alcohol withdrawal less difficult for the patient. Symptoms related to alcohol withdrawal have been observed in patients on a ketogenic diet. They were less severe and less disabling. The keto diet can therefore help in phases of transition, such as that of alcohol withdrawal. Number 8. Heart failure. The fat contained in so-called ketogenic foods could prevent or even cure heart failure when it is linked to a metabolic process. This study, whose results were published in 2020, reveals the effectiveness of the keto diet on mice that had a heart problem. It will surely be a few more years before we can prevent or treat certain types of heart failure, but these results are encouraging. Let's see what precautions to take when switching from a traditional diet to the keto diet. Number 1. Mood regulation. Your body is used to getting its energy from sugar. By depriving it of the amount of sugar you used to eat, your brain will take a few days to get used to it. During the first few days, you may feel irritable, but this unpleasant symptom will quickly disappear. You may also experience some difficulty in concentrating, which will also disappear quickly. If possible, switch to the keto diet on the eve of a long weekend, or even better, during a vacation. An environment free of stress, constraints, and schedules will help you adapt to your new diet. Number 2. Small inconveniences. Want to take the plunge? First of all, you should know that it will take 3 days for your body to understand what is going on. If you start the ketogenic diet overnight, you may experience some of the same problems: headache, fatigue, mild nausea, and dizziness. These reactions are normal and can be resolved in a few days. Make sure you drink plenty of water and do not limit your salt intake. Add a teaspoon to your usual daily dose. Nota bene, if you have or have had kidney problems in the past, it is imperative that you consult your doctor, because the keto diet puts a heavy burden on the kidneys during the first few days while they adapt. Number 3. Bad cholesterol. The keto diet, with its good fats, can promote the appearance or increase of bad cholesterol. So before you start, get a blood test to make sure your levels are normal. If it is, go for it. 4 weeks after starting your new eating routine, recheck your bad cholesterol levels with a blood test. Number 4. Deficiencies. Although the keto routine is known as an easy diet to follow because it is not frustrating, it is still a restrictive diet. By eliminating most of the carbohydrates from your diet, deficiencies can appear. Don't panic though. It is quite possible to find the missing vitamins and minerals in a cocktail of multivitamins and minerals easily found in pharmacies or prescribed by your doctor. Number 5. The kidneys. By drastically reducing the proportion of carbohydrates in your diet, you will ingest more protein. These proteins, which are good for your health, are still more difficult for your kidneys to filter, so don't overdo the proteins and drink plenty of water. Water not only helps your kidneys with their filtering functions, but also helps you stay healthy. Hydration of the human body is essential, regardless of your diet. In short, the keto diet is a very good solution to lose weight, treat diseases, or prevent them. Do you intend to try this new diet, which has been acclaimed by the medical profession and some top athletes? If you like this video, you can support us with a small like or by sharing the video with your friends. Thank you for your support, and we'll see you soon for a new video.